Organ transplantation allows many people to live a normal and healthy life, but transplantation can put people at increased risk of acquiring infections. One way to prevent these infections is with vaccines. The time period before and after transplantation is critical for vaccine administration. Some vaccines can only be given routinely before transplant, such as live vaccines. Live vaccines use the weakened form of the virus to help protect us from that particular infection. Even though live vaccines are mostly given before transplant, medical research has shown that in some very select cases, measles, mumps, rubella, and varicella vaccinations might be safe after transplant in certain circumstances. A killed or inactivated vaccine is made up of small pieces of a virus or bacteria, such as the pneumonia vaccine. Please be sure to check with your transplant team for more information on which vaccines are safe. Vaccines do work better when they are given before transplant. One common myth is that vaccines do not work after transplant. In fact, vaccines do work after transplant and are critical to help prevent infections like pneumonia and influenza. It is recommended that patients receive the influenza vaccine as early as 1 month post-transplant if in the influenza season. Other vaccines are usually given 3 to 12 months after transplant, depending on the center, once the medications that prevent organ rejection are at stable doses. It is also very important that family members and close contacts are up to date on vaccines in order to help protect the transplant recipient. A common myth is that family members cannot receive any live vaccines. Although the transplant recipient should avoid live vaccines unless initiated by the transplant team, family members can and should receive live vaccines. The transplant recipient does not need to avoid contact with someone that receives a live vaccine as long as they practice good hand washing. If the family member who receives a live vaccine develops a rash, the transplant team should be notified. In addition, a transplant recipient should avoid changing diapers of a child who has received the rotavirus vaccine for a couple weeks after the vaccine is given. This is because the live virus can be found in the stool and could be transmitted to transplant recipients. If you ever have any questions, please reach out to your transplant team. They're always there to support you. In addition, the American Society of Transplantation website has more detailed information and a list of resources for patients and families who want to learn more about this. Thank you for joining us for this episode of Transplant Fact or Fiction: Vaccine Myths.